Good afternoon. Here we're going to host the session for engaging all stakeholders for robust healthcare system. So I would like to ask everyone to come in front so that we can start. This afternoon, our session will be read by moderator, pharmacist Francis Nwagawa, and on our panel we'll be having John Markey from USAID. We'll be having Dr. Jean-Pierre Nyemanzi from MOH. We'll be having Dr. Fraser Karua from AMREF. And we'll be having Dr. Atanaz from HDI. So you are welcome, and I can hand over the mic to Mr. Francis. Thank you very much.
Good afternoon, everyone. Welcome to this afternoon session on engaging all stakeholders for robust healthcare systems. My name is Francis Nwagawa. I'm a pharmacist and a public health specialist. I welcome you to this session that I hope will be an educative and engaging session. I'm delighted and honored to be here today, contributing to the young professionals' journey towards universal health coverage, which I believe will be a reality through the young professionals. Like the theme goes, paving the way towards universal health coverage through young professionals, I have a strong feeling and belief that the young professionals will contribute to this through discussions and experience from diversity backgrounds. Without taking further delay, allow me to welcome and introduce our panelists today. On the panel, we will have Dr. Atanaz, who is a medical doctor and fervent advocate for health equity. He was a Global Health Corps Fellow at Health Builders prior to joining HDI, and also serves as a long-term volunteer for the International Organization for Women and Development in the surgical management for obstacle fistula, general pediatrics, and pediatric surgery. As a program director, he manages all HDI projects and assists the executive director with organizational strategic planning and team management. He graduated from the National University of Rwanda from the School of Medicine, and he is currently the chair of Global Health Corps Alumni Rwanda chapter. It. Our other panelist is Dr. Elizabeth Wanyirigira, who is working with the USAID Rwanda. She has extensive clinical and public health experience, currently serving as the Mission Health System Strengthening Specialist at USAID Rwanda. She previously worked with the Ministry of Health of Rwanda and Rwanda Biomedical Center as a project manager. Dr. Elizabeth is a medical doctor and graduated from the National University of Rwanda, and she holds a Masters of Public Health. You're welcome. Another panelist is Dr. Fraser Karua, who is currently the general manager for AMREF Enterprises Limited, a subsidiary of AMREF Health Africa. Fraser has more than 10 years of experience in the health sector in Africa, having held leadership positions in pharmaceutical industry, health insurance, and clinical services. She is a medical doctor with postgraduate training in public health, business administration, and organization development. Fraser is also a leadership fellow for the Joanna Briggs Institute Adelaide University, and is currently undertaking research for the thesis on to attain Doctorate of Business Administration Finance. Frazier is also a member of the Expert Review Committee for the Global Access to Medicine Index. With this diversity of panelists we've just had, I hope that we are about to hear from the expertise and experiences they are about to share with us. And being the civil society organizations, the private sector, the foundations, how can all of us come along from diversity backgrounds and contribute to strengthening healthcare systems? I also hope that we will hear from the audience. They have different backgrounds, different expertise that will also contribute to this afternoon session. Thank you. Dear panelists, welcome to this afternoon session. It is said that at least half of the world's population still do not have full coverage of essential health services, and about 100 million people are still being pushed into extreme poverty because they have to pay for health care. And over 800 million people, that is almost 12% of the world population, spent at least 10% of their household budgets to pay for health care. And to step to this success from the above mentioned figures, it can't be achieved either only by governments or by individuals, but also the involvement and active role of almost everyone. I would like to build from this statement, and from my understanding and from a lot of questions that came into my mind, is that the civil society organizations has been and will remain an active role and player towards achieving universal health coverage. The statement embodies a comprehensive package. Dear panelists, could you take us through the private and civil society role and interests that align with the goal of ensuring people have access to health care they need without suffering financial hardship? Dr. Frazier?
Good afternoon, and thank you for having me on this panel. And I think the brief background has stated the problem clearly. And coming from the civil society organization, which is AMREF Health Africa, the NGO, the global NGO, and also having running the semi-commercial, which is a social enterprise at AMREF Enterprises Limited. There are multiple roles that AMREF has played over the years, as well as other organizations such as AMREF. And just to mention a few, first of all, is that the civil society organizations are supposed to be the intermediary or connecting communities to other stakeholders, and therefore speaking on behalf of communities in which they work in, and therefore being a voice that represents the true needs within the community. And therefore, when you talk about universal health coverage, civil society organizations have a huge role to play in bringing the people aspect In the PPPs now, we call them public-private people partnerships. And so civil societies have a huge role in representing the people and working closely with the various stakeholders as an intermediary to bring solutions and appropriate needs to fore. Secondly, I think the civil society has a huge role. We're talking right now about the fourth industrial revolution, where technology and other aspects of